Good morning. Today lectures will be about concentration for patients with hepatitis in dental settings. So, hepatitis begins with the liver as a part of our body is responsible for several rules. The most important rules are drug metabolism, so drugs we take are metabolized by the liver. Coagulation factors. The liver is responsible for the synthesis of coagulation factor, which is really important to help for prevention of bleeding and help blood clot formation. Secretion of bile is also the responsibility of the liver. So if there is any abnormality that occurs within the liver, those rules can't be occurred as they should be. So what is hepatitis? Hepatitis means inflammation of the liver. Unfortunately, it's only being confused with viral hepatitis, but there is still different types of hepatitis. We have hepatitis that's caused by paracetamol. We have hepatitis that is caused by alcohol abuse. These are referred to as non-infectious hepatitis, while what will be caused by viruses is called infectious hepatitis. Infectious hepatitis can be caused by many viruses. So we have hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis D, and hepatitis E viruses. These are different viruses, but they have all the same target organ, which is the liver. Okay. Patients with hepatitis have a clinical presentation. They have signs and symptoms. The signs and symptoms can be classified into three categories. The first one is the pre-icteric phase. Icteric means like jaundice, so pre-icteric phase. Two, the icteric phase, and the third one is the post-icteric phase or the recovery phase. Starting with the first one, which is the pre-icteric phase, the patients start to have non-specific symptoms of abdominal pain, nausea and vomiting, and fever, which is an elevated body temperature. This phase usually takes about 2 weeks, and the patient starts to enter into the icteric phase. The icteric phase is characterized by yellowish discoloration of the skin, mucosal membrane, including the sclera of the eye. This phase also characterized by having patients to complain of liver enlargement, hepatomegaly, and abnormal liver function tests. This phase continues for about 8 weeks, and then the patient moves into the third phase, which is the recovery phase. The recovery phase, all the non-specific symptoms of the abdominal pain, fever, jaundice, all become reduced, but the hepatomegaly and the abnormal liver function test might take a longer period to recover. This phase might continue for about 4 months or about 16 weeks, 4 months. Okay. However, not all the patients go into the recovery road. Sometimes they take the wrong turn into chronicity and become chronic carriers. Chronic carriers can happen with certain subtypes of viral hepatitis, which is hepatitis B, C, and D. Chronic carriers may become asymptomatic for a long period, but still can transmit the disease. Patient can become asymptomatic for up to 30 years, and then symptoms might start to develop and liver complications start to occur, like, for example, liver fibrosis, liver cirrhosis, or even hepatocellular carcinoma. What is this lecture about? Is about the dental management, how we can deal with patients having hepatitis in our dental practice. Patients with hepatitis can be either patients with an active hepatitis, patients who are still having the symptom of it, patients having history of hepatitis, patients having high risk for hepatitis infection, or patients who are deemed to be hepatitis carriers. The last one would be patient with suggestive signs and symptoms of hepatitis. Starting with the first category, which is the patient with active hepatitis. Patients having an active hepatitis should not receive any dental treatment, except for emergency treatment in hospital setting. Patient having an active hepatitis means they have an abnormal liver function test. An abnormal liver function means that the coagulation factor cannot be normally synthesized, so the patient will be at an increased level for bleeding. So INR, bleeding time, need to be evaluated prior to the delivery of the dental treatment. In addition, since the liver is not functioning normally, drugs can't be metabolized as they should do in the normal condition. So drugs metabolized by the liver should be used in reduced dosage or best avoided if possible. Drugs that are metabolized by the liver include local anesthesia, for example, paracetamol, also metabolized by the liver. These are common medications that we usually use in dentistry and needs to be used in low doses to avoid any complication. The next would be patients with history of hepatitis. Patients given history for having hepatitis in early childhood and that have been transmitted by food usually will have hepatitis A. Okay, these usually will recover without being chronic carriers. So there is no change in the treatment plan except for having strict infection control. Patients who had the hepatitis through contaminated blood products usually will have hepatitis B or C, which is bloodborne, and might become chronic carriers. Okay, contaminated blood products can be transmitted, for example, for patients with hemophilia, who takes coagulation factors transmitted. Okay, patients who have anemia, like sickle cell anemia, severe sickle cell anemia, which requires several transfusions, might have a contaminated blood product being transfused to them, and they will eventually have hepatitis B or C or sometimes even HIV. Okay, for those patients, we need to establish whether they are chronic active carriers or not, which we will discuss in the second slides. Patients with high risk for hepatitis. There are certain patients who fall under this category, who are deemed to be high risk for having hepatitis. For example, patients who are healthcare workers, patients who undergo hemodialysis, renal failure patients who undergo hemodialysis, recipient of blood products, as we have just said, patients, for example, with anemia, patients with hemophilia, usually are recipients of blood products, and illicit drug users, which shares the same needle. Okay, they are high risk for hepatitis. Also, you don't need to change anything in the treatment plan except for having a strict infection control policy. And if the operator have been injured during the treatment, those patients need to be referred for serological examination for viral markers of hepatitis. Patients who are hepatitis carriers. Patients who are carrier for hepatitis can be either an active carrier, which means they have the disease and they have an active presentation of it. Okay? Having an active presentation of it means the liver is not functioning normally. So no treatment can be delivered for those patients. Those patients are increased level of bleeding. Those patients cannot metabolize the drugs we give them, so no treatment should be given unless emergency treatment in hospital setting. While chronic carriers without any symptoms on them, strict infection control policy can be adopted and the treatment can be delivered for those patients. If if we have a patient in our clinic that have a suggested sign and symptoms of hepatitis, which this include an abdominal pain, nausea, vomiting, fever, and yellowish discoloration, jaundice. Okay, so no elective treatment until consultation from physician is provided. If we suspect any patient having hepatitis or they demonstrate those features which suggest that they might have hepatitis, we need to refer them for supervising for their physician for examination, and maybe he will send them for investigation, and then have an answer from the physician whether or not those patients can have the dental treatment or not. Otherwise, emergency treatment in hospital setting can be provided. If it is an elective treatment, we might be able to postpone the treatment and refer the patient to physician. But if it is an emergency treatment, it's best to refer the patient for hospital setting for the delivery of the treatment. That's all what we have for the patients for hepatitis. For any question you have, you can post it on the comments and I'll be more than happy to answer it. In addition, I'll try to upload this lecture on YouTube and share the link with you. Okay, thank you.